On the Wednesday morning I was asked to join a debate where the motion was that CAR T cells would become the standard of care for relapsed diffuse large B-cell lymphoma in 5 years' time. So I was asked to talk against that motion. So I had the somewhat difficult task of really standing in the face of what is a very exciting and progressive technology and really pull apart some of the data that we have describing the effect of these cells in diffuse large B-cell lymphoma. And really the points that I was making was that currently we clearly need longer term follow-up before we really understand how effective CAR T cells are in diffuse large B-cell lymphoma. We clearly need to do a lot of work understanding why these cells are so toxicity and how we can try and prevent and ameliorate the toxicities that arise in patients. And then also, lastly, the issue of just quite how expensive these agents are. Currently they're costed at approximately £1 million per patient once all of the supportive therapy is provided for the patient. So really that's an unaffordable price tag in many healthcare economies. So really we need to look at how we can negotiate lower prices for these agents with the companies that are producing them. We are very much in our infancy of understanding how we use these cells, and I think in the coming years we will see reduction in the amount of toxicity associated with them. There's already some very early data suggesting that we can avoid the toxicity by giving preemptive Tocilizumab to the patients. There's undoubtedly going to be a reduction in the cost associated with them because there are many different companies and academic groups that are synthesizing their own CAR T cells. So with more competitors out there, the price will certainly come down. And I think also we're understanding more how we can manipulate these modified T cells and actually give them further attributes that will enable them to fight the cancer cell even more. So the biology is very much in its infancy, and I think in 5-10 years' time we'll be handling much more sophisticated CAR T cell products.